Hello, welcome back to my channel Forensic Forum. In this video, we will talk about immunoelectrophoresis. So let's see the introduction. What is an immunoelectrophoresis? It is a combination of electrophoresis and immunodiffusion. This technique follows precipitation reaction. The term, immunoelectrophoresis, was first coined by Grabar and Williams in 1953. In this method we first separate an antigen mixture into its component parts by electrophoresis and then add the antisera or antibody to be tested by double immunodiffusion. What is the procedure of this technique? In this technique we use agarose powder for the preparation of gel. The gel is placed into the electrophoresis chamber with the samples on the cathodic side. An electrophoresis runs will be followed for 20 minutes 100 volts. Then a well is cut and antigen is filled into it. The first step is electrophoresis of antigen for about an hour. After the electrophoresis, a rectangular trough is cut in the agar parallel to the direction of migration of antigen and filled with antibody. Antiserum. Diffusion of antibody is allowed on the surface of gel for about 18 to 24 hours. Precipitation lines will be developed with each separated component of the antigen. In this image a antigen is first filled into circular well. Then after the electrophoresis antigen gets separated into its component. A trough that is a rectangular well is filled with antibody and left to precipitate with the antigen for the duration of about 20 hours. White cloudy precipitation line is formed as a result of the antigen-antibody reaction. Result interpretation. The presence of white opaque elliptical precipitine arcs represents antigen-antibody interaction. The absence of any precipitate line is the indication of no reaction. Different antigens, proteins, can be identified based on the intensity, shape, and position of the precipitation lines. What are the advantages of this technique? The main advantage of immunoelectrophoresis is that many antigens can be identified and quantitative analysis is possible in serum samples of human at a time. It is used in identification and characterization proteins in complex mixtures. It is basically useful for detection of normal and abnormal serum proteins like myeloma proteins in cancer patients. Thanks for watching.